Thank you very much, Ian, and good morning, bore da everyone. I'm really delighted to be part of today's event, celebrating 1 year of operation of Uned Gobaith. To be celebrating the first anniversary of a service so vital to the health and well-being of our mothers and babies is a testimony to the success, hard work and dedication from everyone involved in making this work. I'd like to start then by paying tribute to you all, without whom this great service would not have been possible. So thank you for the work you do and the way you do it. The difference it's making is immeasurable in terms of the individual lives of every person that receives the service. And it is great as well to look back at this year and look at what we can learn from the operation of the service and how we ensure that mothers receive the best care possible. I'm sure the discussions today will play a large part in this, and I look forward to considering the findings of the review of the service's first year in operation in order to further develop services. The review is being led by WISC and will be complete this summer. As Buffy has said, having a baby is a life-changing event, and for many it's full of joy and excitement. However, for some it can cause acute illness which requires specialist support. For some it can even be the most difficult event in their life. The Mother and Baby Unit and the wider perinatal mental health services are crucial in delivering the care needed to support the health and well-being of mothers, their babies and the wider family. Our mental health is incredibly important. There is no health without mental health. This is the government's and my key priority, and this is reflected in the prioritisation of investment in mental health services in Wales. And I'd just like to assure you how personally invested I am as Deputy Minister in ensuring that we have the perinatal mental health services that we need for everybody in Wales. As Ian has said, my interest in this has long preceded coming in to government and included my time as committee chair. So this is a long-standing commitment for me. And it was absolutely brilliant a couple of months ago to visit Uned Gobaith, having had to postpone the visit several times due to the pandemic. It was absolutely amazing to go there, to see the facilities there, but most importantly, to talk to the wonderful staff there who are obviously doing a really outstanding job and really changing the lives of the families who are using the unit. It is, of course, also crucial that we continue to develop and improve support in the community through our community perinatal mental health teams, and all health boards are working towards improving this support in line with the Royal College of Psychiatrists perinatal community standards. And whilst we are proud of having the Uned Gobaith, we know that the location is not suitable for the whole of Wales population. We remain committed to providing provision closer to home for those who live in North Wales and for this support to be available in the Welsh language. And again, I'd like to assure you that I fully understand the importance of having services delivered in Welsh for women receiving mental health services, and I'm really committed to ensuring that is delivered. Now, the modelling undertaken so far in Wales has evidenced we don't have enough demand to have a standalone unit in North Wales, and therefore WISC and Betsy Cadwaladr University Health Board have been working with NHS England in order to develop a joint unit in North West England, which enables ease of access from North Wales. I know that you're hearing later from our National Clinical Lead for Perinatal Mental Health, who continues to lead the National Networks programme in Wales. This includes the development of fully integrated care pathways and all Wales training resources. And I know many of you here today have played an integral role in shaping the pathways. And I'd just like to take this opportunity to thank Sharon Fernandez for the amazing work that she's doing leading the perinatal network. I know now that I'm getting out and about and talking to people on the front line, just how much the role that she plays is valued and central to the service improvements we are delivering. As Deputy Minister, I'm going to shortly be providing an update to the Children, Young People and Education Committee on progress against the recommendations from the report undertaken on perinatal mental health in Wales. So absolutely committed to continuing to meet those recommendations. And we've also recognised the vital role that our third sector and voluntary colleagues play in supporting families during the perinatal period. And there are great examples across health boards in Wales where this is happening. I know voluntary sector partners have also been invited to become members of the perinatal network, and I really appreciate your contributions. As you may be aware, our Together for Mental Health delivery plan comes to an end this year. We have commissioned the ORS to evaluate the strategy, and the results of the evaluation will be an important body of evidence influencing our next steps and future focus. Welsh Government policy officials will continue to work closely with stakeholders to ensure a fully inclusive approach to the development of the future strategy, ensuring that all views are taken into account. And I'm really keen to have the views of everybody here fed into that. I can though assure you that perinatal mental health will continue to be a priority in the next strategy. And I look forward to your experience and expertise coming forward in shaping that. So thank you again for inviting me today. It's a proud moment for everyone and a real honour for me to be here with you. I'm really sorry that I can't stay for the whole webinar, but unfortunately I have to leave just before 11 as I have a hospital appointment. But just before I finish, I want to reiterate my gratitude to everyone who played a role in the delivery of these services, and in particular in the establishment of Uned Gobaith. The difference you make is truly humbling and inspirational. Diolch o galon.